Hello, 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 Greensboro, surrounding areas, North Carolina, South Carolina, Georgia, Florida, each and every one. As far as New Jersey, I forgot. How could I forget New Jersey? Welcome to SHEM Ministries. That is Souls Honoring Elohim's Mandate. And this is our SHEM tonight. Please have a word of prayer with us as we begin our spiritual, healthy, enlightening mandate ministry. Dear Heavenly Father, we give you all the honor, the glory, the thanks, and the praise. For my God, this is a day that thou art made, and we are exceedingly glad in it, Lord, because we are still in the land of the living, which means you have given us another day, another chance, another opportunity to be the vessel that you called us to be for your people. An empty vessel, Lord, that we are willing to allow you to fill us up with your spirit, your anointing, and use us as you see fit. Yes, Lord, we have given all that we know how to give, to sacrifice us for your use. And Father, I thank you because each and every day you reveal even more how to give unselfishly of ourselves for your use in your kingdom. So, Father, please have your way. Speak to your people on tonight as we continue to share our message with them regarding the health of their back. So tonight, our subject again, God bless each and every one of you. Our subject again is get back. Now, how you choose to accept that, get back from me, like I am protecting my back, or let me get back the back that I need to support me. So many people suffer every single day with back pain, every day. There are people who suffer with back pain so much that they don't even think about it anymore. It's just a daily thing. It's just like brushing my teeth. Is there. It needs to be done. Or well, let me not say brushing my teeth. Eating. We know we need to eat. We know we may have back discomfort every day of our lives, and it's just a part of us. But tonight I want to talk again about get back. And this is our part 2. I am Dr. Anna Shaw Devlin. I am a family nurse practitioner, and I say this for our new viewers. As we are multi-streaming, we are still on Facebook Live as well as YouTube. And we have been doing that for a while now, thank God. Pastor Devlin was very instrumental in getting it. The thought was there, but he put forth much effort into making a way out of no way, right? Because that's what happens when you allow God to have total control over your life. The impossible things that man would say you never could do, God says, yeah, they can. Because they're willing to listen to me, hear me, and be obedient to me. So when you listen, when you hear and listen to God and then are obedient, yeah, he will do some things in your life. So we're not going to prolong the time. I do want to pick up from where we left off on last week. And we were talking about things that cause our back to hurt. And I actually very quickly I'm going to go through some slides that I created for you all. So let's scroll up, and I'm going to go through these really quick. We talked about the spine. So the bone structure, spine, number one, has to be healthy. You got to have strong enough bones to support your back, right? And then we're going to talk a little bit about muscles, because muscles are what make our bones move. The way we twist, the way we turn, the things that we do to our back on a daily basis, really, you don't even realize why you have back pain. Most of it was precipitated by you. The fact that you forget to protect your back when you bent over and didn't squat and lift with your legs. The way we twist. And thank God for the message on yesterday that Pastor Devlin delivered when he talked about insomnia and sleep. And he mentioned restless legs, and he mentioned all these things that happen to us, that our inability to sleep and the sleep apnea and all of this stuff. That, believe it or not, muscles are utilized, first of all, your diaphragm, just for you breathing when you have sleep apnea and you're not breathing deep enough, or you have to wear a CPAP. We're going to show you pictures of the muscles of the back, the abdomen, how they wrap around from the abdomen to the back. How do you think you twist? And we are going to talk about the feet. Yes, we're going to talk about the feet are the foundation of our posture that supports our back. So we've got a lot to talk about, and like I said, you guys know me. I do a lot of talking, and I get stuck sometimes. But tonight, Father, in the name of Jesus, help us to flow, and flow, not stagnated, but a good flow, not a trickle either. We want to run water like a faucet. All right, so let's start with the spine. These are just reviews, okay? And I tried to redo some pictures so that I could show you even better, like a better close-up. We start with the cervical spine, right? And I told you that there were 7 vertebrae in your cervical region, and that's the neck. And so the cervical region, C1, or atlas, is the first cervical vertebrae, and it supports your skull. So if you got a big head, a heavy head, not so much because of the brain, because you don't have to have the biggest brain in the world to be the smartest person. Do I need to say that again? You do not have to have the biggest brain to be the smartest person, because the brain matter could be empty and not contain much. All right, I'm going to leave that alone. C2, or axis, so you have an atlas and then you have an axis. It is the second cervical vertebrae. It has a vertical projection called the dens around which the atlas can rotate. So that allows you to be able to turn your head from side to side. And then as we go down, we have, you could see in that picture, I think C4, and then all the way down to C7. And then we start with our thoracic, which is where our lungs and our ribs and all of that, right? There's 12 vertebrae there. And T6, the sixth one, is it's where the ribs attach to the thoracic vertebrae to form the rib cage, okay? And then we continue to go down, down, down to the lumbar region, and that's the low back part, right? So now let's switch to this other one. All right, so we have our lumbar, and there are 5 vertebrae in the lumbar region. L2 is the second lumbar vertebrae, okay? And like I said, there's only 5. Now, this is where most people have the biggest issue when they have low back pain, and that lumbar region. And many times it's lumbar sacral pain, discomfort that we talk about when we start complaining of low back. Now, the sacral region, 5 fused vertebrae. Now, if you want this information in more detail, I suggest you go back and review Get Back Part 1, because we're just quickly going through this, and this is just to refresh your memory as we move on. So your sacral region has 5 fused vertebrae, and you have, and fused means they're not mobile, they don't move, they're fused together. Then you have your sacrum and your coccyx. They're formed from fused vertebrae. The sacrum connects the spine to the hip bones. And I even showed you that the sacrum, how it did connect. And I'm going to show you here again. There's the ischium. And if you see where the muscle, there's muscle that connects, that's covering it. But that in between the ischium, the 2 hips, that is actually your sacrum right there. Okay? And then that goes down. Let me scroll up a little bit into, here's another view, the front side. You have your hips, the ischium, all the way around to the pubis, the pubic rami down there, and the symphysis pubis is the little area that connects the 2, right hip, left hip, okay? And then you have your coccyx, which I did not put that on there, but your coccygeal region is 4 fused vertebrae, all right? So, quick, we went through that, and understand that when something is fused, it doesn't move. So, many times, if you do excess movement in that region, the area of the low back is what moves. So you understand why, if this area is fused, that any pressure, or if you fall, or if you jump up and down, the force is primarily on the lumbar sacral region. But remember, the sacrum is fused. So most of the discomfort or the extra weight and pressure goes to the lumbar, because that is the part of your back that moves. Okay? It's not fused. And remember, we talked about disc. So you have disc in between your vertebrae. Many times we have these intervertebral discs, and you can see that. This like the little gray thing in between the little vertebrae. Over time, those discs, just like, let's see. Oh, yeah, your tires. So you have brake pads, right? Think of your intervertebral discs like brake pads. They wear out over time and have to be, or may need to be replaced if you don't take care of them. So what takes care of your brake pads? Stop slamming on brakes. Stop braking so much. Learn how to drive defensively, that you're not forever hitting the brakes, You scan the area ahead of you. Go ahead and move over into the other lane so you don't have to hit the brakes. Well, guess what? Think about things that we do that we can prevent extra pressure and tension on our disc in our back. especially the lumbar region where low back pain and most back pain occurs. All right, now that we discussed the vertebral or the bones that hold the back or support our back or what makes up our back, let's talk a little bit about muscles, okay? First of all, let's go to this picture here. All right. Yes, that is complex looking. Wow. Do you really think that I can see all of that? Okay, check this out. I'm not asking you to see it, to read it and understand it. I'm showing you this picture just so you'll see how complex our back is and how God gave us so many muscles to control movement in the back. So if muscles are what cause our back to move, so every time you do some crazy movement, you're using these muscles. And if the muscles get overused, do you not understand how many times our back pain and discomfort could be muscular in origin, the pain, discomfort, right? Now, let me also say this to you. Every tissue, every cell, everything in our body needs oxygen. God created it that way. You have to have blood flow to the body. Every place in our body needs blood flow. Some need more than others, but you have to have blood flow to your muscles too. Yes, you do. So if you're anemic, lack red blood cell production, the red blood cells carry the oxygen, you have poor circulation, so the flow of that blood is delayed, or you feel me? You kind of hear where I'm going with this? We do not realize until we have a problem how important certain things are in our body. So high cholesterol, clogging our arteries, so the blood doesn't flow through the arteries, eventually causes decreased oxygenation to our tissues, our organs, our muscles, our everything. How about bones have blood flow in them as well, especially the long bones like the femur? Do you know if you fracture your hip bone, your thigh, that you can have excessive bleeding because they're very vascular? You just can't see it. You don't realize that going through your spine, your back, you have nerves, you have blood flow, you have muscles, you have tendons and ligaments, you have a lot of stuff that can contribute to back pain and discomfort. All right. So the only reason I put that picture up there was to show you how detailed and delicate God created us to be, where we can do those things that we take for granted, such as bending over and touching our toes, tying our shoes, putting our shoes on, all those things. Now, here is another picture that I definitely wanted to show you. And I tried to make this one bigger than it was when I initially showed it to you, or tried to on last week. First of all, you need to understand that the muscles in your abdomen also affect your back. So do you see the transverse abdominis on the side? That wraps around from your abdomen to your back, okay? There's the quadratus lumborum, right? Forms part of the abdominal wall at the back. It bends the trunk to the sides. It allows you to twist. Now, I was telling you on last week that I was having some back discomfort, and I realized that quadratus lumborum is probably something that I have overworked, and because of the way I was sleeping and this, that, and the other. But anyway, I just wanted to show you that picture, a better picture. The psoas major is attached to the femur. Femur is your what? Your hip. It helps bend the trunk forward. So when you, be careful how you bend forward. Many times you should not just lean forward, but if it's necessary for you to squat and bend, that may be better for your back and your alignment, the hips. Okay? All right. So now, the other thing I wanted to, let me see. I wanted to show you this because this is a better picture as far as the ribs. When we take a deep breath and how the back, the muscles there on our spinal column, right? Just a picture just so you can see the detailed work of the back muscles. That is what these pictures are for, not for you to look at the labeling and try to figure that out. No, see your shoulder blades? See how the muscles go up there? See your ribs? And some of us can palpate our ribs, okay? And you see how the muscles are. Here is another view, okay? I wanted you to see that as well. And this is a little more detail. The muscle in between the ribs. Just the ligaments and the muscles, okay? Now that I showed you those things, let's look at, let me see, did I show you this one? Okay, no. I wanted to show you, remember the transverse abdominis that I showed you? Well, anyway, I was showing you that there was a muscle that started in the abdomen that wrapped all the way to the back. That transverse abdominis, do you see how long it is, how elongated it is? It is actually the deepest of the three muscles that form the sides of the abdominal wall. It squeezes the abdominal contents when it contracts. Wow, that is major. Okay, so here's the front of the transverse abdominis, and on this picture, if you look on the left side of this or the right side of this, you can see the back side of that transverse abdominis. Okay, big thing. Now that we covered the bones, we covered the muscles, I want to talk about something that people forget a lot about when they start having back pain. What do we forget about? We forget about this thing here. Let me show you this one first. We forget about our feet. Oh my goodness. What supports the whole entire body? What supports the weight of the entire body? Now check this out. You got your feet there, okay? You've got your toes, you've got your midfoot, and you got your hind foot. So the hind foot is actually the heel. It's called the calcaneus, and it's I don't know if you can see it well enough, but you got your toes, your midfoot, and your hind foot, right? Okay, and most people don't even think about their back or how they walk until their feet start to hurt. And if you ever notice, if you ever have a problem with your foot, what happens next? If you have a foot pain or a problem with your foot long enough, next thing you know, you either have a pain in your knee or you have a pain in your back. Think about it, or your hip, right? That is when you realize how connected they are. Now, let me show you, I hope I can do this correctly. Look at there we go. The ligaments of the ankle. Now, you know You have to have flexion and movement of the ankle so that if you were to jump up and down, there's enough movement and flexibility that you don't fracture your feet or your foot or the bones in your feet. Okay, so there's the ligaments. Then let me show you the muscles in the foot. So you've got, and I'm not going through the different muscles, I'm showing you the ligaments and the muscles that control the foot and the lower limb. And here's another view. This is underneath. So you've got your calcaneus, which is your heel. You got the muscles under the bottom of the foot. If you look at the left picture, that's the muscles up under the bottom of the foot. So they got the foot kind of up in the air, okay? So I'm trying to explain that to you. And the bones are on top. So the ligaments, the muscles, these are what control the foot. I needed to show you that, okay? Now, I'm going to go back with the with the skeletal part of the foot as we talk about back pain as it relates to our feet. First of all, you need to take care of your toes, right? If you can't walk because your toenails are ingrown or your toenails are so thick that you're limping, that affects your feet and your posture there, your feet and how you walk. And it affects whether or not you can put on your shoes. And we also need to talk about the fact that you do need good shoes. One thing that we don't know, and I myself did not know until I was probably in my late 40s, was that I had flat feet. No one never told me, and I never paid it any attention that I had flat feet. Most people don't know that they have flat feet until they go to the military. The military will tell you, okay? If you don't go to the military, you may not know. So if you know you have flat feet, then you know how to protect your feet. You know how to wear certain insoles that have arch supports, okay? So shoes are very, very important. And the main thing about a shoe, now Pastor Devlin can correct me if I'm wrong, is the insole, how well the shoe is built and the insole. Because you can have beautiful looking, cute shoes, but there's no support. All right. Then the posture and stance. Now, some of this has to do with us. Some of that has to do with how we sit. Do we sit straight up? Do we have a good posture when we sit? And do we stand? Do we stand with a good posture with our feet? I forgot how many inches apart. I think it's kind of like our shoulder width, if I'm not mistaken. So if you got, depends on your build and the way your body is. I think it should be shoulder width apart, if I'm not mistaken. But how you stand is significant and has a lot to do with your back. Your gait, how you walk. Some of us have, certain deficits. I know I myself had difficulty walking as a child, and I had to go to therapy and learn how to walk because I had a deficiency in one of the muscles, my calf in my left leg. And the foot itself was turned outward. And so therapy was a blessing to me and taught me how to walk without falling. So gait is how you walk. Now, whether or not you walk or run. Some people who run, first of all, if you don't run in the right shoes, you're going to hurt your feet, hurt your ankle, hurt your back. It all travels up your knees. So it'll be your feet, your ankle, your knees, and then your back. Okay? All of it's connected. And God created it that way for a reason. Now, the last thing I want to say that affects our feet and our back in regards to back pain is our weight. Now, many times your doctor will say, in general, for overall health, you need to lose weight. And when I say overall health, I mean overall health. Umpteen thousand things associated with our weight. Our breathing, our sleep apnea, all that stuff. Our pressure on our abdomen, diabetes, high cholesterol, fat around our heart, so many, many, many things. The weight, increased adipose tissue around the bladder. The bladder has a hard time squeezing. There's too much fat around it. We can go on and on and on and on, but we're not. Just do understand that your feet, your shoes, your posture, the way you stand, the way you walk, if you run or not, and your weight all affect your back. Okay? All right, so let's get rid of that. Let's get rid of that. And let's go back to me. Woohoo! All right, now that we covered all of that, okay, and I'm just a little warm. It's kind of hot outside. All right, so let's go back to some information about back pain. And we talked on last week about symptoms of back pain, and I don't think we need to go over that again. I want to talk to you about, we did talk about medical conditions that can lead to back pain, not just the physiological things, right? The bone structure, the muscles, not just the musculoskeletal, which includes the feet, because that's what we've covered. Because primarily, believe it or not, that's like the most percentage of our back pain. And let me say this before I forget to tell you. If you start having back pain or increased back pain, so if you're a person that has back pain period and you start having increased back pain, start looking at what have I done? Did I stretch the wrong way? Did I, look at some things that you could have done. Flip-flops are not supportive. One thing I had to do when I found out I had flat feet, I ended up with plantar fasciitis, and that was the reason why. And that's the fascia underneath your feet. And I didn't touch on plantar fasciitis, but it was inflammation. Any itis is inflammation. Okay, so it's the fascia, the ligaments and everything that cause you to be able to walk. So when I had flat feet, no arch support, I found out that over years of walking in a hospital on concrete floors, right, was eventually caused inflammation in the fascia. Okay, and that was my plantar. Plantar is your heel. So the plantar fasciitis is what I ended up having. And treatment was, once I got rid of the acute inflammation with a steroid injection into the foot, and it worked for me, and taking an anti-inflammatory short term, I ended up getting rid of all my flat shoes. The little low, cute, beautiful sandals and things that I had, all those cute little shoes, I ended up replacing them. And there were certain tennis shoes I could not wear because they didn't have the arch support that I needed. And so I ended up having to buy more expensive shoes. And so currently I wear Asics, Saucony's, and Atrix. Okay, Atrex anyway. There's so many good shoes out there now. Don't worry about trying to, the name brands that I just named. Just know that you need shoes that a podiatrist may recommend that have excellent arch support. And the excellent arch support actually also helps to distribute pressure equally in your feet. So the toes aren't the only ones that have all the pressure. And believe it or not, high heel shoes, they will keep a podiatrist in business and orthopedic surgeons and whatever in business, but high heel shoes are not the best for us as women. Little small heel, you don't have to wear every day. But these women who wear high heels every single day, okay, all right. Later on in life, different story. Okay, so where was I? Okay. So medical conditions, the quad equina syndrome, and that was where I was telling you about the nerve roots that arise from the lower end of the spinal cord. So when a person has low back pain, the lower back and upper buttocks, right? As well as numbness in the buttocks, the genitalia and the thighs, the inner thighs especially. That can be quad equina syndrome. It's where those nerves are pinched. How we would know about that, and it's a medical emergency if they lose bowel or bladder function. I'm just throwing this stuff out there. I did talk about it a little more on last week. Cancer of the spine. These are rare things I'm just mentioning. Infection of the spine. Pelvic inflammatory disease. Believe it or not, women who have inflammation or infection in their pelvic region, which could be from a sexually transmitted disease, or but pelvic inflammatory bacterial vaginosis or any type of disease can end up with pelvic inflammatory disease, which if you saw the picture where I showed you the abdomen and the back are so close together, you can have back pain from that. You can also have a kidney infection and have back pain. You can also be constipated. You got to think about the abdomen and the proximity of the back and the abdomen and what's in that region, right? You can be full of poop and your back hurt. Go get a KUB, which is a kidney, ureter, and bladder one view film. And all it shows is you are full of poop and just need some good bowel movements. Remember, you got many, many feet of colon. And just because you have a bowel movement every day doesn't mean that you're emptying out. If you calculated how much food you ate and how that food compacted like a trash compactor, and you don't keep up with how many ounces of food you eat. So, especially meat, because meat takes longer to break down and digest. So you're a big, big meat eater, and you eat all this meat for breakfast, lunch, and dinner, and in between. And it takes days for meat to break down, especially red meat and steak, okay? And you want to know, just because you had a little bowel movement every morning, you good. No, you still full of poop because it took days for it to break down. And you keep eating like that every single day, 3 meals a day. Ding, ding, ding. Okay, I hope I'm making sense. But that is one thing. I tell people when they, first of all, start talking about having back pain, are you peeing and pooping? Okay. What about your shoes? Do your feet hurt? Do your knees hurt? Simple things such as that. So do a check of your body and ask those things. What have I done lately? Now, if you went to the gym and you lifted too much, when you feel the burn, okay, there's a difference between knowing that you're lifting enough and the ripping burn that says I've lifted too much. Okay? Ask me how I know. I've been going to the gym and I've been working out. I've been trying to whoop. I've been trying to build up some muscle so I can handle pasta. Oh yeah. So I know about that. I took a week off from the gym because my back was bothering me. And then when I went to the gym the other day, Saturday actually, I was looking at the machines and calculating and figuring out, that's why my back was hurting right there, because I was trying to build too much muscle too quick and I was lifting too much. So I had to cut back. I did. Yeah. Just because, don't think I don't know nothing about myself. I crazy. Other sleep disorders we talked about. And like I said, Pastor talked about it on yesterday. Individuals with sleep disorders are more likely to experience back pain than others, especially that restless leg syndrome, okay? You thrashing about all over the bed in your sleep. You tossing, you're turning, you're this, you're that. You're twisting your back all kind of ways. You're doing all this stuff and you sleep and don't even realize what you're doing. But if you've ever seen, well, let me say this. People who go and have a sleep study done, they have a video of you while you're sleeping. And if you watch the video and see how you actually look when you sleep, you'll understand why you have a lot of discomfort from your neck, shoulders on down. Okay? All right. Shingles. We talked about that on last week. Okay? And I'm not going to hit that again. We're going to move on because I want to cover some more stuff. We talked about back pain from activities, poor posture. I'm not going to hit over that again. Now, we did talk a little bit about disc. I showed you the intervertebral disc in between your vertebrae and how those discs can be damaged just like the brake pads in your car. Bulging disc, much in the same way as ruptured disc. A bulging disc can lead to more pressure on a nerve. You also can have sciatica, a sharp and shooting pain that travels through the buttocks and down the back of the leg. This may occur when a bulging or herniated disc presses on a nerve or when a muscle pushes specifically on the sciatic nerve. Okay? Arthritis, especially osteoarthritis, can cause problems with the joints in the hips, the low back, and other areas in the body. In some cases, the space around the spinal cord narrows, and that's called spinal stenosis. Okay? Unusual curvature of the spine. These are things we talked on last week. I'm just going through them real quick. And we talked about scoliosis and different scoliosis, the abnormal curvature of the spine. Because I showed you a picture of normal curvature. We talked about osteoporosis, where the bones themselves are weak and brittle. And that's because of, over time, bone demineralization over time, and that can happen from hormones, from menopause, age-related degenerative changes. Kidney problems, we talked about kidney infections. Your kidneys are located the costovertebral angle right up under your spine. Well, no, I'm sorry. Where your ribs and the spine connect, that little V is called costovertebral angle. Costo is the rib cage and vertebral is the spinal cord. So where that V is costovertebral, and that's where your kidneys sit. Okay? All right. Now, let's see. Where are we? All right. The human back consists of a complex structure. Remember these. Your back is muscles, ligaments, tendons, discs, and bones. And they all work together to support the body and enable movement. Support the body regardless of the weight of the body. And if you're top heavy, you may understand. Anyway, all right, we're not going to touch on that. And the only reason I'm saying that, I'm not saying that to knock anyone or saying that, you can't help your body structure. I'm just saying it so that you'll realize that if you are this, you can understand why you have more back, knee, or foot pain, right? And you may have to accommodate that by different supports. Okay, ways to support yourself, especially your shoes, okay? And the segments of the spine are cushioned with cartilage-like pads called discs. Problems with any of these components can lead to back pain. In some cases of back pain, the cause remains unclear. Damage can result from strain, medical conditions, or poor posture, among other things we already discussed. All right, now let's move on. Because we talked about kidney infections. We talked about, this is just going through a list of difficulty urinating, fecal incontinence, loss of control, bowel, bladder, numbness around the genitalia. That was the sciatica and all that stuff we talked about. Now, let's talk about when, wait a minute, 9, 10, yeah, there we go. I'm still in the right When to contact the specialist. A person should seek medical help if they experience any numbness or tingling, or if they have back pain that's new, especially after a fall we talked about on last week, and that does not improve with rest. Now, if you go sit your butt down because you know you've been doing too much, okay, after an injury or a fall, like I said, with numbness in the legs, tingling, wait a minute, I can't feel my feet like I used to. This is new, acute, not chronic. With weakness, fever, unexplained weight loss, okay? Those are the things. Treatment. Let's talk about treatment. Back pain usually resolves with rest and home remedies like a heating pad. Lord, thank you, Jesus, for the heating pad. But sometimes medical treatment is necessary. Home treatments many times consist of over-the-counter pain relief medications, usually NSAID, non-steroidal anti-inflammatory, but you have to be careful how many NSAIDs you take, and if you have kidney disease, with caution. They are nephrotoxic. They are toxic to the kidneys. You also have to take them with food, not to cause you to have a GI bleed, right? Gastrointestinal bleed, because it can cause irritation of the lining of your stomach and your gut. So you take them with food, okay? And if you already have a history of gastric esophageal reflux disease, definitely make sure that you take Aleve, ibuprofen, any type of Motrin, anti-inflammatory, with your PPI, such as your Prilosec or your Protonix or whatever you're taking. And actually, Prilosec is the drug of choice right now. And make sure you take that with food. Hot compress or an ice pack to a painful area may also reduce pain. It depends on the person. If you know you injured yourself and you start feeling kind of swollen, like, oh gosh, ice is the first, then heat. Ice causes vasoconstriction to prevent the tissue from swelling. Heat causes vasodilatation, increases blood flow to the area. Remember what I told you, you got to have blood flow. So heat is excellent when you have pain and discomfort. Remember that. Heat increases blood flow. Blood carries oxygen. Increasing circulation and oxygen to an injury is very crucial regarding your recovery process, okay? If home treatments do not relieve your back pain, a doctor may recommend medicine or physical therapy or both. Let's see. We do not want narcotics unless we absolutely have to. But if your pain is so bad that you can't even, I'm hurting so, and you can't, you're hyperventilating because the pain is that bad, you need a narcotic, okay? Temporarily, short-term use only. You don't want to get dependent on a narcotic. All right. And it should never be given alone. You should be able to do heat, other therapies, physical therapy, all of that with the narcotic if necessary. If a doctor's only treatment of your pain is to take a narcotic, run, Forrest, run. That is not going to help you in the long run, because your brain will be desensitized and you will keep escalate the amount of pain medication needed to get the same relief. Your body builds up a tolerance, okay? Now, physical therapy, apply heat, ice, ultrasound, and electrical stimulation, little TENS units. Now, I did find this little unit for my husband. I forgot the name of it, but it's not a TENS unit, but it's similar, where they have little electrodes that he places on his body that he controls with his phone, and it gives him stimulation to the muscle to shock the muscle in a sense and decrease his pain. And so it's actually a muscle release techniques. As the pain improves, a physical therapist may introduce some flexibility and some strength exercises for the back and abdominal muscles. So if you have weak abdominal muscles, it's going to put more pressure on your back. You gotta have good abdominal muscles, and that is one thing I'm in the process of working on myself. And this is something that if I wish I could have maintained all along, so I wouldn't be in a situation where I'm deficient in losing muscle mass as I lost weight. But I did. I deliberately lost weight for health and didn't stay on top of the muscle mass. Okay, so telling on myself, what better way to, all right. Now, cortisone injections. Sometimes we do need cortisone injections. Cortisone is a steroid. If you're diabetic, it can increase your blood sugar. So before you allow a doctor to inject cortisone, you have to tell them, I'm diabetic, this is this. Talk to your primary care physician so you'll know what to do. Make sure you have supplies to check your blood sugar and treatment. Because you never, ever, ever want to fix a problem and create another problem trying to fix a problem. So it's better to be safe than sorry. Safety means stop and think. So it's just like when you get to a stoplight or stop sign, what do they teach us to do? Stop and look both ways. And you always do what? You look to the right, you look to the left, and you look to the right again before you proceed. The same way you do that at a stop sign is the same way whatever decision you make regarding your treatment, you should stop, think, look, and check again if necessary. All right, so they can inject into the epidural space around the spinal cord. Make sure, now I'm telling you, that whoever you let inject, you know what they doing. Doc, hey, how many people you injected? I ain't letting just anybody mess with my spine in my epidural space. Nah, because if I get paralyzed and can't walk because I had a botched up injection, guess what? You messed up. But guess what they had you do? You signed a consent and didn't read the fine print. The fine print said there is a risk, blah, 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 blah. And you didn't read it, but you signed it. Didn't I not say, stop sign, look both ways, and then look again? All right. So cortisone is an anti-inflammatory drug. It helps reduce inflammation around the nerve roots. Injections may also be used to numb areas thought to be causing the pain. Now, a good provider will tell you and show you the muscle and the tissue involved. Every good provider, like those pictures I showed you, now you understand why I showed you them pictures. I showed you all the muscles. I showed you ligaments. I showed you the vertebrae for a reason, knowing that I can't teach you all of that, right? There's no way. I don't have time to teach you all of that, but the same way I showed those things to you, they should show you the same picture and show you where they're going to inject. Okay? If that's their treatment. Now, Botox. According to research, most people know about Botox. Botox reduces pain by paralyzing sprained muscles that are in spasm. So are you telling me, wait a minute. Yes, I'm telling you that muscle spasms. So think about what Botox does. Most women get a little Botox on their face, you know what I'm saying, to relax and paralyze the muscles that cause wrinkles in their face. Well, guess what? You can have muscle spasms that need to be relaxed too. All right? These injections are effective for about 3 to 4 months. So let me tell you the number one Botox for muscle spasms: migraine headaches. Many people have migraine headaches, and they're temporal. And guess what? The doctor will inject in the temporal region and stop those migraines. They are vasospasms that are causing those migraine headaches. Yep, Botox. Now, traction. Pulleys and weights. Now, I don't know if you guys remember me on last week. I think I told you I had frozen shoulder before. And I went to the physical therapist, and I realized my frozen shoulder was, okay, I did it to myself. It was the way I was sleeping. So yesterday when Pastor was talking about sleep, I was like, ooh, you was all in my business, because sleep and how you sleep affects pain, elicits pain in your body if you're not careful. I was getting frozen shoulders the way I was propped. My shoulder was frozen. It wasn't moving. I slept that way. And I had to go to a physical therapist. It was very, very painful. But I had to use pulleys and weights to stretch it. Stretch my shoulder. They can do the same thing with your back. Muscle spasms in your back. Tight muscles. Anyway, I'm just telling you. And this may result in a herniated disc moving back into position. Yes. If you have a disc that's herniated and it's trying to get back into position, it can cause muscle strain to that extent. Yes. Remember, the muscles and tendons and ligaments are there to move the vertebrae. And the disc between the vertebrae. Oh man, is it adding up? Is it making sense now? I hope so. They all link together. That's the method of my madness and showing you all of that stuff that you don't understand. I just need you to link it all together and get your back to where it needs to be for you to function. You may not never get it back to its original, right? Because over time, traumatic injury, over time, overuse, those rotors and brakes and whatever on your car will never be the way they were when you first bought it. Sometimes we got to replace things, or we just condition them. They can take the rotors and I forgot what it's called, but they sand them down and get rid of the ridges. That's what they do before you replace them, if they can, if they're not too thin, okay? I'm just telling you. Same thing with our bodies. But the last thing that you ever want to do, and this is the last of our talk tonight, is surgery. It's the last thing we're going to talk about. Surgery for back pain, it says, is very rare. There's a lot of people who undergo back surgery that really didn't need surgery. I'm telling you the truth. It's just that people say, fix it, doc. Do surgery. I want surgery. I can't deal with this pain. And then they end up, they don't realize that you'll never get your back the way it was. So get back. Don't come at me with that. Because in the long run, there's always going to be a potential for further pain and discomfort, even after surgery. Anytime someone goes in your body and cuts something, there's always the potential for scar tissue. Scar tissue can cause pain too, because the scar tissue can press against nerve endings. So either your pain was from mechanical, musculoskeletal, and then because of the scar tissue and the post-traumatic arthritis from someone going in and cutting in your back, you develop arthritis in that area because you manipulated my bone and you cut all in my, oh Lord. So you got You had one source of pain that ended up being another source of pain. You end up with nerve pain. Nerve pain ain't no joke either. Ask anyone who has nerve pain. Ask diabetics who have peripheral neuropathy. So I don't have to be diabetic. I can get nerve pain because I had surgery. So you gotta weigh it out. You gotta weigh it out. Risk versus benefit. And get second opinion and even a third opinion. What do the insurance company do before they fix something? They say, go get me 2 estimates, at least. Come on now. What is wrong with us? You only have one body, one life to live. One body that God gave you. Okay, I didn't take care of it. Okay, but now I didn't take care of it, but now I'm trying to fix it. So be very careful. Be very diligent. Be very creative if you have to be. I still got my pulley. Okay? And when my left shoulder got frozen, guess what I did? I knew exactly what to do. I went and stretched it out, and I made sure that I started sleeping better. Yeah, I did. I stopped staying up, but let me say this. I was working and going to school too. Staying up all night. Sometimes there have been nights I didn't even sleep at all. Get my paper done, take a nap, and go to work. Come home and do the same thing. So I'm telling you that I put my body through that for years to get education. You do what you got to do. Did I do it the right way? I did the best I could at the time. So I'm telling you and sharing with you, none of us are exempt. We ain't perfect just because, you do better, you know better, do better. Yeah, you're supposed to. But everybody know better don't do better. Do we? How many respiratory therapists do you see smoking cigarettes? Now, they're taking care of people who have COPD that can't breathe. But they're smoking a cigarette on their break because nicotine is addictive. And they started smoking before they became a respiratory therapist, or who knows? I'm just saying. There's no guarantee, okay? But just be careful about surgery. If an individual has a herniated disc, surgery may be an option. Sometimes you do need surgery. Don't get me wrong. But the least invasive, minimally invasive procedure. If you have osteoporosis and you have had compression fractures, which means the weak, brittle bone just dropped and fell, and they fractured easily, like a tooth. You ever have a tooth fracture? Teeth fracture too. I had one time, and guess what? I said, oh, no, we won't get another tooth fracture. So when you have, and I know I'm getting off, but let me say this to you. When you've had a tooth that's been filled over and over and over again, the bigger the area that they fill, you have less and less of the increased potential for your tooth to fracture. So I said, after that tooth fractured and I had to have a urgent root canal and crown, that was not cheap. And I wasn't happy because it was Christmas time. I said, guess what? Oh, I will plan for the future. All the other large fillings I had, we jumped on them 2 at a time. All right, I'm going to get these 2 done this year and the other 2 the next year. And these I'm speaking about molars, okay? Because most of us, if we grew up in the 60s, 50s, we didn't have dental insurance and didn't have all of that. And we ended up with cavities in our molars. Many of us did. So long story short, I didn't wait on the fracture. So I'm telling you, your back, if you know you have osteopenia, osteoporosis, be very careful, cautious, protective of your back. Get your back back and get back. Like, don't come at me with that, because I'm not I'm going to protect my back. So get back means protect your back as well as do everything you can to get your back restored to the best that you can. All right. So functionability is usually what is used to determine whether or not you need surgery. And examples of surgical procedures include a fusion. A surgeon joins two vertebrae and inserts a bone graft between them. So remember when I said about the sacrum being already fused together? God did that. But God gave man wisdom and knowledge that they can fuse the bones together that he didn't fuse together. Okay? All right. But God gave them wisdom and knowledge how to do that. So the vertebrae are splinted together with metal plates, screws, or cages. That's how they fuse them together. There is a significantly greater risk of arthritis to subsequently develop in the adjoining vertebrae. What did I say? I said you increase the risk of scar tissue or post-traumatic arthritis. That's exactly what this is saying. If you've had a spinal fusion, you can develop arthritis in the vertebrae around the fusion. Doesn't have to be. You better keep yourself anointed and you better pray. Pray. Stay prayed up. To God be the glory. But those are the things that you have to consider before surgery. The risk versus the benefit. And then you find out after surgery, well, Doc didn't tell me that. Well, did you listen? Were you willing to listen? Or were you in a situation where you said, take this pain away from me? Just get rid of the pain. Not realizing that temporarily removing that pain could cause pain later. That's what we got to think about. There are artificial discs. A surgeon inserts an artificial disc that replaces the cushion between two vertebrae. They can do that too. There is a discectomy. This, where they remove anything, ectomy, is removal of. Discectomy. Surgeons may remove a portion of a disc if it is irritating or pressing against the nerve. They do not have to take the whole disc. They can do a partial discectomy. Okay? All right. Partially remove. Okay. I didn't realize that was the next one. Partially removing a vertebrae. A surgeon may remove a small section of a vertebrae if it is pinching the spinal cord or nerves. And I'm going to tell you, I pre-op for years, for about 4 years. And I've had patients that I pre-op for similar procedures because they took part out and then years later they had to replace the whole thing. That's what I'm trying to tell you. Having surgery on something potentially can lead to more surgery on the same thing. So before you decide to have surgery, do all the non-invasive things you can first. There are complementary therapies. And basically, complementary things are osteopath. These are physician who specializes in treating the skeletal and the muscles. There's the chiropractor, which many people know about a chiropractor. They treat the joints, muscles, and bone problems. The main focus is the spine, though. So if you know that your spine is out of alignment because you've had an injury or something in the past, sometimes, first of all, make sure your chiropractor did an x-ray. Don't let nobody just go in and adjust you and they ain't doing x-rays. And if you haven't had an x-ray, you go to the same chiropractor for the last 5 years. Guess what? They shouldn't keep adjusting you and not re-x-raying your spine. I'm just telling you, it's worth the money. If your insurance company won't pay for you to have a spinal film, pay for it yourself. It's worth not having long-term injury, pain, or discomfort. Shih Tzu, or finger pressure therapy, is a type of massage where pressure is applied along energy lines in the body. The Shih Tzu therapist applies pressure with the fingers, thumbs, and elbows. Acupuncture, which originated in China, involves inserting fine needles into specific points in the body. Acupuncture can help the body release its natural pain relievers, endorphins, yes, and stimulate nerve and muscle tissue. Now, I don't care who does what for you. Get your research on them. How long you been doing this? How many people have you done? I want to read some reviews. Show me your portfolio, whatever. Yoga, and stop being cheap. I wouldn't be cheap when it comes down to my body like that. Because if you get hurt, guess what? You're going to wish you had spent that extra money up front versus trying to fix it later. Okay? Yoga involves specific physical poses, movements, and breathing exercises. Not that you're doing it for other reasons, but you're doing it just for the stretching and the movements and teaching you how to breathe. Remember what I said. How do you get oxygen? You breathe. So if you don't know how to breathe right, you're lacking oxygen to your vital organs and tissues. And like I said, your bones have blood supply. Your muscles have blood supply. Okay? Some of these may help strengthen the back muscles and improve your posture. Care must be taken that exercises do not make back pain worse. Studies on complementary therapies have given mixed results. Some people have experienced significant benefits while others have not. When considering alternative therapies, it is important to seek guidance from a qualified and registered therapist. Transcutaneous electrical nerve stimulation, or TENS, is a popular therapy for individuals with chronic back pain. The TENS machine delivers small electrical pulses, and like I said, they have smaller devices similar to a TENS unit into the body through electrodes placed on the skin. Experts believe TENS encourages the body to produce endorphins and may block pain signals returning to the brain. Studies on TENS have provided mixed results. Some show no benefit, while others indicate that it could be helpful for some people. A TENS machine should be used under the direction of a healthcare professional. You should avoid a TENS unit if you are pregnant, have a history of seizures or epilepsy, or have a pacemaker. These are electrical impulses. TENS is considered safe, non-invasive, inexpensive, and patient-friendly, and it appears to reduce pain. Guess what? You can buy it over the counter now. Yes, you can. Go into the drugstore and see. Take the time. Do like I do. I walk up and down the aisles and look at just about everything. I sure do. God gave me big eyes and I use them. I do, because I want to know what I'm talking about. Okay? Haven't done it like I would like to. I used to spend hours in the store. Whew, but I got other stuff to do. But of course, everything has risk factors, okay? The following factors are linked to high risk of developing low back pain: occupational activities, pregnancy, and sedentary lifestyle. All right, we have gone over by 15 minutes. I think we have covered all we needed to cover. I talked to you guys on last week about x-rays, MRIs, CT scans, bone scans. Electromyography I didn't talk about, but these are electrical muscle tests. There's blood tests that can be done. All kind of things. Prevention, exercise, posture, your diet, smoking, body weight we talked about. Your posture when standing and sitting and lifting, moving things, shoes, driving, and bed, including your mattresses. We talked all about that on last week. All right. Well, God bless each and every one of you. I am Dr. Anna Shaw Devlin, family nurse practitioner. And I say to you, get back. Get back. Stay away. Prevent back problems, or work to get your back to where it is close to where it used to be. by avoiding certain things and getting the proper treatment and care. All right, God bless you. We will see you on next week for our next segment of SHEM 2, a spiritual, healthy, enlightening mandate ministry. God bless each and every one. Adios, amigos. And thank you again for watching. Don't just be blessed, be a blessing